am Mrs. Devi, Assistant Professor of Home Science, V.V. Vanniyaperumal College for Women, Virudhunagar. Today, I am going to teach about the topic Protein Energy Malnutrition. Protein energy malnutrition is defined as a range of pathological condition, lack of varying proportion of energy and protein, and it is mostly occur in infants and younger children. Kwashiorkor occur in the age group of 2 to 3 and marasmus in 1 to 2 years. The child reacts to the stress of protein energy malnutrition and secrete cortisol, which mobilize protein from muscle and subcutaneous tissue to amino acid pool, resulting in wasting of muscles with no edema. Increased cortisol production decreased growth hormone, so the child is stunned. Clinical forms depends on the type, severity and duration of dietary deficiency. The protein energy malnutrition are classified into 3 categories: Kwashiorkor, marasmus and then marasmic kwashiorkor. Kwashiorkor, that means it is an American word. It means disease of displaced child. It occurs due to the prolonged breastfeeding, inadequate or late weaning. Clinical features: measles. The red rashes appears on the skin. Gastroenteritis, inflammation of intestine. Pneumonia, infection of the lungs. Edema, that means fluid accumulate on the tissues. Growth failure, due to cortisol production, the growth is stunted. Anorexia, loss of appetite. Apathy, that means lack of interest. Dermatitis, inflammation of the skin. Spasm, that means thinness. The child become bony. Soft and thin hair. Angular stomatitis, the cracks will be occur on the corner of the mouth. Chylosis, inflammation of the lips. These are the clinical signs of Kwashiorkor. Next we see about the marasmus. In marasmus, the children with low birth weight and inadequate breastfeeding, early weaning, that cause the marasmus. It is the severe chronic energy deficiency. And then clinical features: extreme muscle wasting, then loose and hanging skin folds, old man or monkey's face, irritability, fretfulness, and then temperature is subnormal, watery diarrhea and acid stool is present, and then lack of subcutaneous fat. Then next we see about the marasmic kwashiorkor. The children exhibit the clinical features of both kwashiorkor and then marasmus. Clinical features of kwashiorkor: then edema occur in the feet and then legs. Features of marasmus, that is wasting of muscles of upper arm and then chest. Then next we see about the causes of protein energy malnutrition. The diet. Diet is which deficit in protein and energy that cause the protein energy malnutrition. Then socio-economic factor. Poverty is one of the most cause of protein energy malnutrition which leads to low food availability. Unsanitary living condition that cause the infection that leads to protein energy malnutrition. Lack of awareness and then improper child care. These are the socio-economic factors that cause protein energy malnutrition. And then environmental factors. Overcrowding of living space with unsanitary living condition that leads frequent infection and diarrhea. Then biological factor. Maternal malnutrition before and during pregnancy that cause protein energy malnutrition. And then treatment. Hospital treatment, dietary management and rehabilitation. In hospital treatment, the following condition should be corrected. Hypothermia, that means decreased body temperature. Hypoglycemia, that means decreased level of blood glucose. And then electrolyte imbalance, then vitamins and mineral deficiency diseases. Dietary management. In dietary management, the diet should be locally available stable foods, inexpensive and easily digestible food should be given. Rehabilitation. The concept of rehabilitation is to provide nutritional training to the mothers under supervision to use locally available foods. Then next, prevention. Special measures like supplementary feeding, nutrition education and immunization to alleviate the protein energy malnutrition. Supplementary feeding are provided at Anganwadi center. Nutrition education that will eradicate the protein energy malnutrition. Immunization. The proper immunization should prevent the infection and deficiency diseases. Food fortification, that means adding micronutrients like vitamins, minerals to the commonly used foods to control and prevent the micronutrient deficiency. And then early diagnosis that will also prevent the protein energy malnutrition. Thank you.